Myofascial release is an alternative healing technique that releases the tension in the myofascial tissues of the body. The word myofascia comes from two words, myo, meaning the muscles, and fascia. These are the connective tissues that surrounds and wrap around the muscle fibers. So when we come into various positions using therapy balls and different parts of the body, we're looking for muscular knots in these various parts of the body. Now, these muscular knots are what we call the trigger points. Trigger point is any spot in the body that triggers pain. And if we develop any tight area in the body, often we may send the pain somewhere else, very distal from the origin of that contraction or the tension. There are various ball techniques that I will be introducing in this course. Certain techniques may be more effective for different parts of the body, or just mainly because we are all different. Some of us will prefer one technique better than the other, so that you have choices to choose from. The most important thing in myofascial release is utilizing various props to support us in the various positions, as well as to enhance the efficacy of that technique. So some of the common props that we will use in myofascial release will be therapy balls, maybe tennis balls, golf balls, maybe foam rollers, the chair, the table, the wall, our yoga blocks, or even using a soft padding like a blanket. There are various stages that we want to adhere to when we practice myofascial release. The first stage is really just coming to the spot where you can find trigger point. And once you find that tender area, you want to stay there and linger for a few seconds. You find the best technique that you should utilize. See if you need to use any props to either decrease or increase the intensity. And we linger there anything from 30 seconds to 1 to 2 minutes. The most important thing to remember in myofascial release is that it is enough once you feel that you have made some changes to the trigger point. Or you know it is enough when you begin to feel too much pain. That means you're there for too long. Then you move away and find another spot to work on. Now, there are various factors that will influence whether you enjoy your myofascial release practice or not. These are as simple as the size of the ball, whether you're using the smaller ones or the bigger one, or the material of the ball. Some of the balls are more grippy and they're more effective in holding the pressure, but for some of us it could be too grippy, that is rubbing too much against the skin. And we also look at the hardness and softness of the ball. Those of us with lesser threshold of pain, then we may tend to enjoy materials that are softer. Other factors that will influence your experience would be the health and the condition of the myofascial tissues of the individual. If you are tighter, then obviously every time you come into any trigger point, it's going to hurt a lot. Then the most important will be the technique that you're applying. Do you just hold static, or are you moving? Or are you moving and stretching at the same time? And as well as the props that you're using. So props will also increase or decrease this effectiveness of the technique that you're applying depending on your ability to access to these props. The benefits of myofascial release is we will begin to enjoy more ease of mobility in the body when we get rid of tensions in these myofascial tissues. You'll find that you also have more improved posture as well as stability. But most important, there is this balance of neuromuscular coordination, right, from within. Now, who are the people who will not be appropriate to practice myofascial release? Obviously, if you have any bruises in the body, any open wounds or cuts, recent surgery, or any operation, obviously pregnancy, avoiding the abdomen area and not holding these techniques for too long, or any skin condition like rashes or hives, or maybe even people with varicose veins. You make sure you're not pressing too hard in that area. And severe osteoporosis, very fragile or brittle bones, or maybe acute rheumatoid arthritis as well. The side effects of myofascial release would be when you finish the practice, sometimes students may experience temporary feeling of nausea, giddiness or lightheadedness, or just in general fatigue. Right? When that happens, you want to make sure that you're taking rest and that you're not practicing the next day or two. If this begins to persist, maybe you need to reassess your techniques, the balls that you use, the duration of your holds, as well as the body parts that you're working on. Maybe you could be pressing on some nerves, arteries, or blood vessels that may be causing these adverse effects. The most important note to remember is after your myofascial release practice, hydrate and drink a lot. Okay? When we practice myofascial release, we're hydrating the fascia, breaking adhesion, releasing tension. So during this time after the practice, we do want to make sure we drink a lot of water and obviously take a lot of rest, because if you feel tired after the practice, this is normal. I hope you enjoy your myofascial release practice.